Welcome to the complete Type 2 Diabetes Deep Dive. If you've watched our main Type 2 Diabetes breakthrough video, you're ready for comprehensive information covering every aspect of Type 2 diabetes, from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting wellness, progression, and health impact. Without treatment, Type 2 diabetes typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be mild fatigue and occasional thirst, but they often expand to affect cardiovascular, neurological, and immune systems over time. The condition can evolve from subtle insulin resistance to severe complications that permeate every body system, including heart, kidneys, eyes, and nerves. The systemic health impact extends far beyond elevated blood sugar, as chronic hyperglycemia triggers inflammatory cascades throughout the body. This sustained inflammation can contribute to accelerated atherosclerosis, nephropathy, retinopathy, and neuropathy. Type 2 diabetes increases the risk for heart disease by 4 times, stroke by 3 times, as well as the risk of kidney failure, blindness, and lower limb amputation, making early intervention crucial for preventing these complications. However, understanding progression also reveals hope for intervention at any stage. Even long-standing Type 2 diabetes responds well to treatment, and the body's regenerative capacity allows for significant improvement, regardless of how long symptoms have persisted. Modern treatments can interrupt the progression and often reverse many of the negative impacts, restoring normal glucose metabolism and vascular health within 3-6 months of beginning appropriate care. Underlying causes and risk factors. Type 2 diabetes results from a complex interplay of genetic, environmental, and lifestyle factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history of diabetes increasing risk by 40% with one parent affected and 70% with both parents. But having genetic risk factors does not guarantee developing the condition. Insulin receptor differences, particularly involving cellular glucose transport mechanisms, contribute to increased insulin resistance. Environmental factors include sedentary lifestyle, high-calorie diets rich in processed foods, chronic stress, and inadequate sleep patterns. People who have sustained periods of high carbohydrate intake combined with low physical activity are more likely to develop Type 2 diabetes. However, many people with these risk factors never develop diabetes, while others with fewer risk factors do, emphasizing the individual nature of the condition. Metabolic factors encompass obesity, particularly abdominal fat, polycystic ovary syndrome, gestational diabetes history, and metabolic syndrome. Physical health conditions like sleep apnea, chronic inflammation, and certain medications can also trigger or worsen insulin resistance. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that Type 2 diabetes is a legitimate medical condition requiring professional treatment rather than a moral failing. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers symptoms, medical history, and laboratory testing for accurate blood glucose assessment. Healthcare professionals use standardized diagnostic criteria, including fasting plasma glucose, hemoglobin A1C, and oral glucose tolerance testing to ensure accurate identification and rule out other conditions with similar symptoms. The process typically includes detailed questioning about symptom patterns, family history, lifestyle factors, and impact on daily functioning. Physical examinations and laboratory tests help rule out medical conditions that can mimic Type 2 diabetes symptoms, such as thyroid disorders, Cushing's syndrome, or pancreatic diseases. Many people feel relieved during the diagnostic process because it validates their experiences and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms without fear of judgment. The diagnostic process also identifies any co-occurring conditions like hypertension, dyslipidemia, sleep apnea, or depression, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of Type 2 diabetes presentations and focus on comprehensive metabolic assessment rather than glucose levels alone. This comprehensive approach ensures that treatment addresses all aspects of the condition and maximizes the likelihood of successful long-term management. My questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected timelines for blood sugar improvement, and specific criteria for measuring progress, including target A1C levels. Inquire about combination treatments, such as medication plus lifestyle modifications, and whether newer treatments like GLP-1 agonists or SGLT2 inhibitors might be appropriate for your specific situation. Discuss potential side effects of recommended treatments, strategies for managing them, and what to do if initial treatments don't provide sufficient glucose control. Ask about lifestyle modifications that can enhance treatment effectiveness, including specific dietary approaches, exercise recommendations, and stress management techniques. Understanding the provider's experience with your specific type of diabetes presentation and their approach to personalized treatment planning helps build confidence in the therapeutic process. Important questions also include discussing warning signs that would require immediate medical attention, how to access care between appointments, and involving family members or support persons in diabetes education. Ask about long-term prognosis, strategies for preventing complications, and transitioning from intensive management to maintenance care. Inquire about continuous glucose monitoring, diabetes education programs, and referrals to diabetes specialists when appropriate. Medications and their effects. Modern type 2 diabetes medications offer effective glucose control with improved safety profiles compared to earlier treatments. Metformin remains the first-line treatment, typically requiring 4 weeks for full effectiveness while producing fewer side effects than older medications. These medications work by reducing hepatic glucose production and improving peripheral insulin sensitivity to achieve optimal glycemic control. Newer medications show promise for comprehensive metabolic benefits. GLP-1 receptor agonists like semaglutide and tirzepatide induce significant weight loss and cardiovascular protection in addition to glucose lowering, avoiding the hypoglycemia risk that previously deterred many patients from intensive diabetes treatment. SGLT2 inhibitors may be prescribed for cardiovascular and kidney protection while longer-term treatments take effect, though these require careful monitoring to prevent ketoacidosis. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different classes to find optimal results. Most people experience substantial improvement within 12 weeks of starting appropriate medication. Side effects, when they occur, are typically mild and transient, including gastrointestinal symptoms with metformin or GLP-1 agonists that resolve as the body adjusts to treatment. Holistic and complementary approaches. Integrative treatment approaches, combining conventional medicine with evidence-based complementary therapies, show enhanced effectiveness for type 2 diabetes management. Recent studies prove that mindfulness meditation can reduce A1C levels by 0.8% through stress hormone regulation. Regular physical activity, particularly resistance training combined with aerobic exercise, produces powerful insulin sensitizing effects by increasing glucose uptake in muscle tissue. Nutritional approaches provide practical tools for managing blood glucose while building long-term metabolic health. Mediterranean and low-carbohydrate dietary patterns show significant benefits for some people, particularly when combined with conventional treatments. Specific supplementation, including chromium, alpha-lipoic acid, and berberine, may enhance glucose metabolism and insulin sensitivity. Community support approaches have proven incredibly effective in providing accountability and motivation that people often need for sustainable lifestyle changes. These approaches recognize that healing encompasses the whole person, not just glucose numbers. The combination of traditional medical and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to optimal diabetes management and long-term wellness. OTC items that can be of help. Several over-the-counter supplements can provide supportive benefits for type 2 diabetes management when used alongside professional treatment. Alpha-lipoic acid and chromium picolinate help improve insulin sensitivity, particularly beneficial for people experiencing peripheral neuropathy symptoms. Berberine supports glucose metabolism and may reduce hemoglobin A1C levels through AMPK activation pathways. Cinnamon extract shows promise for modest glucose reduction through improved insulin signaling. Research suggests that omega-3 fatty acids play a direct role in reducing inflammation and supporting cardiovascular health, supporting the use of fish oil supplementation. Magnesium and vitamin D have insulin-sensitizing effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Glucose monitoring supplies, including lancets, test strips, and alcohol wipes, can provide immediate feedback during blood sugar management. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions. Self-help strategies. Empowering self-help strategies provide immediate tools for managing type 2 diabetes while building long-term resilience and self-management skills. Blood glucose monitoring techniques quickly identify patterns and can be used to make real-time dietary and activity adjustments. Carbohydrate counting and portion control help identify and manage post-meal glucose spikes that often accompany diabetes symptoms. Cognitive behavioral techniques include stress management methods that bring significant glucose benefits. Creating structured daily routines for meals, exercise, and medication provides stability and predictability that reduces glucose variability. Regular sleep hygiene practices support optimal hormone regulation, including insulin sensitivity. Gradual physical activity progression helps overcome sedentary patterns that maintain insulin resistance. Keeping detailed glucose logs helps identify triggers and successful management strategies. Building social connections through diabetes, support groups, and maintaining enjoyable physical activities prevent isolation and provide natural stress relief benefits. These strategies complement professional treatment and provide sustainable tools for long-term type 2 diabetes management. Supporting loved ones. Supporting someone with type 2 diabetes requires understanding, patience, and knowledge about effective approaches that truly help, rather than inadvertently causing stress or shame. Listen without judgment and avoid giving unsolicited dietary advice, as this minimizes their autonomy and can increase anxiety around food choices. Instead, acknowledge their daily management efforts and ask how you can best provide support during challenging moments. Learn about their specific glucose management needs and respect their need for meal timing and medication schedules while encouraging gradual progress rather than dramatic lifestyle overhauls. Offer practical support like joining them for physical activities, helping with meal preparation, or providing transportation to medical appointments. Encourage professional treatment while avoiding becoming their primary glucose monitor or trying to police their food choices. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout and relationship strain. Support groups for family members and friends of people with type 2 diabetes provide valuable resources and connection with others in similar situations. Celebrate small victories like improved A1C levels or successful lifestyle changes, understanding that diabetes management is ongoing with ups and downs. Prevention strategies, building resilience, and implementing prevention strategies can significantly reduce type 2 diabetes risk and prevent complications in people with prediabetes. Regular physical activity, including both aerobic and resistance training, creates a foundation for optimal insulin sensitivity. Developing healthy eating patterns early helps people navigate food environments without developing insulin resistance. Maintaining healthy body weight provides natural buffers against metabolic stress that can trigger diabetes development. Learning to identify and address stress patterns before they become chronic prevents the development of cortisol-driven glucose dysregulation. Regular health screenings and maintaining optimal sleep quality help prevent risk factor accumulation. Early intervention during prediabetes, when insulin resistance begins, can prevent progression to type 2 diabetes entirely. Education about diabetes risk factors helps people recognize early warning signs and seek help promptly. Building stress management skills enhances metabolic resilience and reduces inflammatory triggers. These prevention strategies benefit everyone, regardless of diabetes family history, by promoting overall metabolic wellness and longevity. Subscribe now to join thousands getting reliable health information that improves lives. As knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,